Good evening and welcome to Rock Center. There's a very good chance our first story here tonight will stay with you for some time because of the individuals you're about to meet and what their stories say about our system, in this case, our healthcare system. This is about good people who've had something bad happen to them, and they end up staying in hospitals long after their initial treatment is over, even though there are much better options for them, and even while other patients may need that hospital room. And this story affects every one of us. Tonight, Kate Snow reports on the bizarre system that has patients, their families, and hospitals trapped in limbo.
62-year-old Barbara Latashevich lives in suburban Chicago, surrounded by the things she holds dear. Plants, lots of them, photos of Pope John Paul, who she met as a child in her native Poland, and pictures of her grandchildren.
Oh, look, cute. How many grandchildren do you have?
2.
Oh, let's see. Right here? These 2?
Yeah.
1, 2.
Barbara insists on serving coffee. It's all very intimate and homey. Except Barbara is living in a hospital room.
You've been here 2 years now, right? 2 years in this hospital.
2.5 years, she says. Barbara arrived at Adventist LaGrange Memorial Hospital in 2009. She'd suffered a stroke while cleaning a house, a job she'd been doing for 20 years. The stroke left her paralyzed on one side. Several weeks later, she was well enough to leave the hospital, but she stayed.
She hasn't needed to be in this acute facility for a long time.
Dr. Richard Carroll is the chief medical officer for the hospital.
Barbara showed up here 2.5 years ago. Why is she still here?
It's a great question. It's really a function of how our healthcare system is working right now, which is it's not working very well at all, particularly in cases like this.
Barbara is what's known as a permanent patient, one of many hidden in hospital rooms across the country, the product of a broken healthcare system. That's because under the law, hospitals have to treat any patient who needs emergency medical attention, even if they have no way to pay. But a hospital's responsibility doesn't end there. It can't discharge someone without a plan in place for their ongoing care.
You can't just discharge her out into the street.
We just can't discharge her out into the street. Legally, we can't do it, but more importantly, ethically and morally, we can't do that.
It has to cost a lot of money to keep someone for 2.5 years.
It costs an enormous amount of money.
Can you tally up how much money her health care has cost?
From the hospital perspective alone, it's been about $1.4 million.
$1.4 million.
$1.4 million.
Barbara's care costs way more than it should. At a fraction of that cost, she could be at a skilled nursing facility, getting more appropriate care. But here's the problem. Barbara has no insurance and she's undocumented. She can't pay, so no nursing or rehab facility will take her. They don't have to. Unlike hospitals, they're not required by law to treat everyone. That left LaGrange with no choice but to keep Barbara. She's been rolling these halls ever since.
This is completely illogical. I mean, the idea that we would spend $2,000 a day, it would be cheaper to take these patients and send them to the Ritz-Carlton. They could get room service all day, and that would be cheaper.
Dr. Ashish Jha is a practicing physician and a professor of health policy at Harvard University. He says some patients stay an extra week, some months, some, like Barbara, stay years. It isn't good for the patients who may not get the rehab or specialized care they need.
There are thousands, if not, tens of thousands of people who get stuck in the hospital who are well enough to go to someplace else. It's incredibly expensive for them to be in the hospital.
They're taking a bed from someone who might actually need it more than they do.
They're using a bed that they really shouldn't be in, and that's making it harder for somebody else who is potentially and likely much sicker. It makes it harder for that person to get into the hospital.
Is the problem getting worse?
I think the problem is getting worse.
No one keeps track of the exact number of permanent patients, but government data shows the number of uninsured hospital patients in need of long-term care increased 20% from 2005 to 2009. We spoke with officials at dozens of hospitals across the country who reported housing patients who didn't need to be there.
Most of them are Americans. There are many who think, well, I'll never be in that situation because I have health insurance. What they don't know, they may just not be aware that their insurance company won't cover all the long-term services that they need. And obviously there are, 40, 50 million Americans who don't have health insurance. And if they get hit by a bus, they get sick, they're in this situation.
That's what happened to 59-year-old Garrick Amato. Garrick arrived at Banner Heart Hospital in Mesa, Arizona, in the midst of a heart attack. Several days later, he was ready to move to an extended care facility. Garrick had worked part-time as a salesman for a local discount store. He had no medical benefits, so just like Barbara, he had no way to pay.
I don't have any medical coverage. I work part-time for Big Lots for about 7 or 8 years. I guess no nursing home will take me because I don't have any insurance.
Garrick has spent most of March and much of April in the hospital at a price 17 times higher than the extended care facility. Caseworkers tried to get him on Medicaid, the government health insurance for the very poor, which would pay for his rehab treatment. But because he's a single adult without dependent children, he didn't qualify in Arizona. Dr. Jha says many Americans don't qualify.
You essentially have to be pretty poor to get Medicaid. So if you own a home, if you have a business, your ability to get Medicaid is severely limited.
Do you have to wait until you lose the business, lose the house, and then you can apply for Medicaid?
So in many states, that is exactly what needs to happen.
And meantime, where is that person? At the hospital?
They're often stuck in the hospital.
There's hope for Garrick. He may eventually recover enough to take care of himself at home. But Fatima Kaidarova will never be able to live independently. She may look like she belongs in a hospital, but she too could be getting appropriate care somewhere else for a fraction of the cost. For more than 2 years now, Fatima has been living at Maimonides Medical Center in Brooklyn, New York, after suffering a stroke. Pam Breyer is the president and CEO of Maimonides.
In a perfect world, she should be where right now?
In a perfect world, she should be either at home with her family caring for her or in a nursing home.
Fatima, a historian from Uzbekistan, was visiting her grandchildren Zarina and Nigina in New York when she got sick. Nigina visits every day to wash Fatima's hair and exercise her limbs. But the grandchildren say they can't afford to pay for nursing care and they can't take her home. And that breaks their hearts.
We don't have a house and we don't have the care that she needs.
You wouldn't be able to provide the care all day long at home?
No, that's why she needed.
Tell me why you couldn't do that.
Because I'm working. Yeah, I'm working.
Why not say, look, you have to figure out a way to deal with this? I know it's difficult. I know you have a small apartment. I know you're working.
First of all, we don't have the power of law to force her family to take care of her. And we might suggest it, we might recommend it, but we can't compel it, nor can the state. And so she stays with us.
A stay that someone has to pay for. And Jha says the cost of permanent patients eventually is passed on to all of us.
The bottom line is we're all paying for it. When the hospital has a big bill, they're going to have to find a way to get that, and insurance companies end up jacking up the rates for everybody.
In Arizona, Banner Hospital recently found a charity that agreed to pay for Garrick Amato's move to long-term care. After years of struggling to find a more appropriate facility in the U.S. for Barbara Latashevich, LaGrange Hospital turned to the courts for permission to do something drastic. They'd found a place for her at a medical facility, but it was in Poland, the home country she hasn't been to in decades.
How did you feel about all this? I'm really curious how you felt. You're the patient. You're the person living here.
Sorry.
It's okay. You don't want to leave?
Sorry.
No, I'm sorry. I don't mean to make you cry. What makes you cry?
Because I got used to living here, Barbara says. Those grandkids she showed me live nearby in Chicago with their dad, Peter, Barbara's son. Peter objects to his mother being sent to Poland, but says he can't take his mom to the apartment he shares with his children and another family.
I wouldn't be able to provide as much help and support and care for her. She's got a lot of medical conditions where she requires 24/7 care.
I'm thanking everybody for the care that gave to me in the USA.
Recently, the court gave the okay to send Barbara to Poland. The hospital workers had grown fond of Barbara and threw her a goodbye party.
But at this time, we would like to welcome all remaining passengers to board through the gate and the 9 doorway.
And just last month, the hospital paid to fly Barbara, her son, and a medic to Krakow, Poland. Fatima remains at Maimonides in Brooklyn, and the hospital is still working hard to find a solution for her family.
Some people might say, well, it's very expensive to go to a hospital. It's expensive if you have insurance to go to a hospital. And cases like what's happening with your grandmother are driving up the costs for everyone else. If it were someone else's grandmother that we were talking about, would you think it's fair?
But what's the choice? What can we do? I know that other people paying it, there's no choice.
What's going to happen to Fatima?
She's going to stay in the hospital unless we can find a spot for her.
Otherwise, she'll stay here potentially for the rest of her life?
She could stay here potentially for the rest of her life.
Kate Snow here with us in the studio. Does any facet of the so-called Obamacare health care speak to this?
It helps in this sense. If it goes through, we all have to have health coverage, insurance, right? It's a mandated health coverage. So that would help someone like Garrett Amato in Arizona. It would help Garrett because he would have to have insurance. But there's nothing in that language of that law that says you have to have long-term health care coverage, and that's critical. States will get to decide whether they want to require that or not. If you don't have that, you may end up in the same situation as these patients.
And the doctor jokes about a Ritz-Carlton, but couldn't there be a long-term care facility that these hospitals send the patients to and still save money and actually make it better for them?
In an ideal world, sure. And the hospitals are constantly talking to long-term care facilities, and they say that they try to work things out when they can. But frankly, it's a lot of money we're talking about, and nobody wants to be saddled with that kind of debt.
And you talked to Barbara today by telephone?
We did.
In Poland?
We reached her in Poland. She's doing well. She said she's fine. She's in a smaller room, more modest room. She doesn't like it as much, but the food is good. It's Polish food, she said, and she's being well cared for. She did say, though, that she misses her family enormously. She's worried that she's never going to see those grandchildren again.
One of the reasons, as I said, I think this story will stay with all of us who have seen it. Kate Snow, thank you.